AMIIF and Erbitux, two drugs that are derived from living cells. In short, they're biopharmaceuticals. Both are now being produced here at the Merck Serono Biotech Center in the Swiss town of Coursier-sur-Vevey. This is a major move, says the head of the center, Jens Regelin, because until recently the center focused only on the multiple sclerosis drug AMIIF.
With the existing facilities in place in the past, Merck could only produce restricted amounts of proteins or monoclonal antibodies, but we needed a large-scale expansion to now really supply all the big quantities of monoclonal antibodies that will come, be it to supply the new biosimilars program or Erbitux, and that really requires large-scale capacities that are today not available within the company.
Merck has invested a total of 400 million euros in the center in the form of new production areas, fully automated quality controls, logistics operations, and a new wastewater treatment plant. It was a challenge to convert the center into one of the largest and most modern facilities in the world.
The project lasted for 5 years. There was over 1,000 workers on site, including all the personal employees here. And it was extremely complex to have this construction work ongoing while at the same time continuing to produce AMIIF drug substance. So we built on an existing running facility, and this was the main challenge.
Here in Switzerland, there are now two methods for producing biopharmaceuticals: the perfusion method and the fed batch technique. Perfusion is used to produce smaller batches, as in the case of AMIIF. By this method, animal cells in a bioreactor are continuously supplied with a fresh nutrient culture. The desired therapeutic protein is then continuously drawn from a part of that culture. To produce larger amounts of antibodies, as in the case of Erbitux, fed batch is used. In this technique, cells are gradually fed into larger and larger bioreactors until there are so many cells that a large amount of the active ingredient can be harvested. Biopharmaceuticals are derived from living cells, and therefore strict guidelines must be complied with. This is a highly complex process.
The biotech production processes need to be extremely well controlled. We cannot tolerate any slightest deviation from a cell culture process, from a purification process. So all the conditions, pH, cell densities, temperature, oxygen, need to be constantly monitored and really adjusted to the exact definition of the specification. Any deviation from quality attributes could lead into severe conditions for the patients, and this cannot be tolerable, actually.
Highly qualified staff, excellent raw materials, top quality materials, and fast exchanges between process development and production provide the best possible conditions in Coursier-sur-Vevey. A fifth of the global demand for biopharmaceuticals is now being met here, and production is set to expand. In summary, the investment has already been worthwhile.